my next question is when a patient comes to your clinic or you're gonna see some patients, so if they have multiple issues, if they have multiple complaints, like they have neck pain, back pain, shoulder pain, other things also. So my question is how you're going to distinguish between the symptomatic area and true dysfunction?
Yes, that's a very relevant question in our day-to-day clinical setting.
Yeah.
It's not easy to answer this question because number one, it starts off, first of all, there must be a certain level of establishment of that clinical relationship with you and the patient. Yes. If I see the patient on the very first session and you can see the patient is desperate for pain relief, sometimes it's important to kind of settle that down for them before they have the confidence to continue to let you treat them. Yes. I try to do both. Means give them a certain sense of relief so that they can develop that confidence in you and you can go into other form of work. Yes. Yeah, I think usually that's how I would do it. If they allow me to, I will. So I can give you. I can tell you. I can share with you some of the things that I do sometimes because when the patient comes in. When the patient comes in for treatment, they're just lay people, right? Yeah. So they only know one thing: I have a problem. Please fix it. Yeah. You know, it's a very simple, logical deduction on their part. Now, how are you going to break that up for them to understand? It's not easy, right? Yes. One of the things I can share with a lot of the young osteopaths, if they have frustration deciding where to start, always start with something that you can be in control. So sometimes I give a very good example. Like sometimes when I see some patients who comes in and they have a very, let's say they have a very painful and stiff cervical spine, and let's say if I would palpate a certain level of hypertonicity in the sternocleidomastoid, of course the straight thing you want to do is either you mobilize the neck or you can release the sternocleidomastoid. But if I can show them how tight that sternocleidomastoid is, and then after followed by a treatment at let's say the diaphragm, and when I come back and I say, did you notice that it's softer now? They might be like very intrigued by what you do because that was sets the precedence that, oh, wait a minute, maybe my symptoms is here, but my problem is somewhere else. Yeah, if you can do that, that's always a very good start. If you're confident, Yeah. So in that way, you try to reach out to the patient, but you also trying to reach out from the symptomatic perspective. But sharing with them, there's a more bigger universe that's underpinning the problems that you have.